Meza, and today I will be talking about bronchitis. Bronchitis is a very common lung disease in the USA, which affects approximately 5% of all adults annually. Now, what is bronchitis? Bronchitis is the inflammation of the lining of the bronchial tubes within our lungs, which causes the overproduction of mucus cells, which leads to the overproduction of goblet cells, which ends up causing us to have difficulties breathing and can make us cough a lot because of the overproduction of mucus. Bronchitis can be caused by bacteria as well as by viruses. This happens in part because we breathe in different toxins and bacteria, which can lead to bronchitis. Now we'll be looking into the history of the disease. Bronchitis itself was discovered in London by a physician named Charles Bandam in 1808. He used this name bronchitis to describe an inflammatory infection of the mucous membrane which lined the bronchial tubes. All throughout the 19th century, bronchitis was constantly defined as the inflammation of the bronchi. Bronchitis would run rampant throughout the 1800s as bronchitis was one of the main causes of death in urban areas of Europe. Bronchitis is more commonly found in females than in males, about 5.1% to 2.3, and is more common in obese individuals. The prevalence of bronchitis also increases with age. As one gets older, they become more susceptible to bronchitis, as well as when they are very young, like as a newborn to 5 years old, before they get their vaccinations, they are still pretty susceptible. In addition, the prevalence also varies by ethnicity, with white people having the highest amounts of people who have bronchitis at 4.3%. Then they are followed by African Americans and Hispanics. Etiology. Bronchitis is the inflammation of the airway characterized by an excessive production of mucus. It can be both acute or chronic, with acute bronchitis being triggered by a viral or bacterial infection and can cause a common chest cold. It may also result or stem from smoking or other irritants and usually only lasts about a week. Chronic bronchitis, on the other hand, is more severe with more serious coughing and a lot of phlegm, and it produces mucus for days to months on end. It also involves a major remodeling of the airway mucosa and submucosal glands. Chronic bronchitis is almost always associated with amnesia, and since the 1960s, the combination of the two have been known as chronic obstructive pulmonary disease, or COPD. Familial or intergenerational associations for chronic respiratory disease have been observed with an increased risk of chronic bronchitis in people with family members who also had the same virus. Now we will be talking about the difference between acute bronchitis and chronic bronchitis. The main difference between the two is that chronic bronchitis is where you are going to be pretty sick for a long severity of time. You're looking at a few weeks to months of constant coughing and overproduction of mucus with high levels of phlegm in your throat. Acute bronchitis, on the other hand, only lasts a few days or for a week. However, both of these forms of bronchitis share the same symptoms, with the only main difference being that one is going to be pretty short, which would be the acute bronchitis, and the longer one is going to be the chronic bronchitis. Who is most susceptible to bronchitis? Looking at the graph, you can see that when we are really young or really old, we are more susceptible to both chronic and acute bronchitis. When we are looking at race, white people were most susceptible to both chronic and acute bronchitis, with each of them having about 4% of the race getting bronchitis each year. Again, as I said earlier, family history does play a role with your ability in fighting off bronchitis or if you'll be getting it. As stated earlier, if you have family who does get bronchitis, you'll be more likely to obtain it and get it yourself. Females are more likely than males to be diagnosed with chronic bronchitis as well as acute bronchitis. Now we will be looking at a few possible causes for bronchitis. If you smoke cigarettes or if you vape, you are at higher risk of both chronic and acute bronchitis. If you have gastric reflux with repeated bouts of severe heartburn, you can irritate your throat and make yourself more prone to developing bronchitis. Same goes for low resistance. This may result from another acute illness such as a cold or from a chronic condition that compromises your immune system, making your immune system weak and allowing the bronchitis to more easily take over. You can also get bronchitis by exposing yourself to lung irritants. Your risk of developing bronchitis is greater if you work around certain lung irritants such as grains or textiles, or if you are constantly exposed to chemical fumes or smoke. Some signs and symptoms of bronchitis include a slight fever, which includes an all over exaggerated cough, chills, and noticeable chest discomfort. You'll also be quite fatigued and feel slow and tired. You might even feel as if you are in a bit of pain. You'll have shortness of breath with an intense tightening in your chest, and it'll be a little hard to breathe, and you'll be feeling a bit suffocated. You'll also have an excess production of mucus, so you will have a lot of phlegm in your throat, and you'll be having to cough a lot. You'll also have a runny nose, and you won't feel very good. Here we see that there are many contributing factors to bronchitis. When we look at the environmental side, we see that we can be more susceptible due to allergens, smoke in the air, contaminated air, dust, environmental pollutants, residents in a polluted area, or if we are living in crowded living conditions. Now, same for the lifestyle. There are also a lot of factors for the lifestyle, such as smoking, vaping, exposing yourself to air pollutants, if you have prior history of asthma, or if you have a family member who also had bronchitis. Also stated, if you are constantly getting sick, your immune system will be weak, allowing the bronchitis to attack more easily. Now we will be looking at the morphological changes. Bronchitis is a condition where the airways of the lungs become widened, leading to a buildup of excessive mucus that can make the lungs more vulnerable to infection. This can cause acute inflammation of the trachea and large airways. Not only are individual gland profiles bigger, but in chronic bronchitis, the thickness of the gland layer as a whole was increased from 0.2 to 0.6 millimeters. Further, the bigger the glands secreted more mucus. Not only do glands enter hypertrophy in chronic bronchitis, but there is also an increase in the numbers and size of the goblet cells in the surface epithelium. This will lead to an increased diathesis of white blood cells, with the orientation of the beat among ciliary fields becoming essentially random. This causes inflammatory within the bronchial tubes, which can process increased blood flow and cellular activity within this affected bronchi. Some physical changes that you will see will be a thickening of the smooth muscle layer, as well as large volumes of sticky mucus, which will lead to an increased coughing. This increased coughing can lead to a sore throat as well as a runny nose. You'll experience chest pain or the sense of tight feeling or being constricted in your chest. You will have an increased body temperature leading to a fever. You'll be feeling overall pretty sluggish and slow, pretty drowsy, and overall fatigued. You'll also have a shortness of breath with pretty abnormal breathing or irregular breathing. Right here, you can see on the left, this is the histology, how a healthy bronchial tube looks versus someone with bronchitis, where you can see that inflamed goblet cells with the damaged epithelia. And you can also see how little the airway is compared to a healthy one. Now we'll be talking about some cause and effects. The airway in the lungs, called bronchial tubes, becoming inflamed can cause excessive coughing. There can also be infection in the bronchi, which can cause them to become irritated and inflamed, which can lead to the production of excessive amounts of mucus. When there's inflammation in the bronchial wall, this will lead to mucosal thickening, epithelial cell desquamation, and denation of the basement membrane. Thank you for listening. I hope you all have a good day.